Today we are going to talk about the extracellular accumulations, which is the amyloidosis, which is the most important or most common protein deposition inside within the tissues and outside the cell, in between the cell. This is called as the amyloidosis. Osis mean deposition and amyloid mean the misfolded proteins or the abnormal proteins. So our view, amyloidosis is due to abnormal production and deposition of protein within the tissues of the body. There are several types of amyloids, each of which is composed of different protein and is associated with certain diseases. Microscopical morphology of amyloidosis. On light microscopy, we can find an amorphous hyaline deposits that has a apple green birefringence upon polarization of a Congo red staining. So what does mean Congo red staining? It's a type of staining that they use for amyloids. If you're going to use like Congo red staining, then the amyloid they appears like a orange red in color, and that will be helpful to differentiate between certain other accumulations of fibers and the amyloid depositions. Once you have done with staining with the Congo red and you study that specimen under a polarized light, that specimen changes the color to greenish color, that similar to that of apple green. So that's why it's called as the apple green birefringence. I will make you able to differentiate between these uh, histological appearances later on. On electron microscopy, most forms of amyloid are 7.5 to 10 nanometer fibers in a beta plated sheet configuration. These are the protein foldings. Some organs they usually affect during amyloidosis. They are kidneys, spleen, liver, and heart. So these are the organs that usually affect in amyloid depositions. So there are two main types, primary and secondary, and there are other types as well. So primary amyloidosis has amyloid light chain deposition, that is the AL, amyloid light chain deposition, or just we can say AL amyloidosis, whose fibrillary proteins is made up of kappa and lambda light chains. Primary amyloidosis may be seen in plasma cell disorder like multiple myeloma or B-cell lymphoma. In both cases, like multiple myeloma and B-cell lymphoma, a lot of plasma cells they are produced, and those plasma cell proliferation they make or they synthesize a lot of immunoglobulins like IgG. So the light chain of IgG will be more in number. That's why there is a deposition of a light chain of the immunoglobulin. So it's a primary amyloidosis where we can find light chain or AL amyloid depositions. But most cases occur independent of other diseases, but sometimes it may be because of other diseases. The second one is a reactive systemic amyloidosis or secondary amyloidosis, has amyloid associated protein, that is AA protein, whose precursor is serum amyloid A, that is SAA. So when these proteins are produced, and which organ mainly is responsible for the production of these amyloid? So during inflammation or chronic inflammatory processes, different sort of cytokine are produced, and those cytokines act on the liver, and the liver now going to synthesize a lot of amyloid proteins. So those amyloid proteins start to accumulate into the serum, into the blood, and from that it reaches to the organs and start to accumulate there. So in case of chronic inflammatory processes, you can find some amyloid associated proteins from the liver, and they start to accumulate in different organs, even liver itself. So it has amyloid associated protein, AA protein, and the precursor is the serum amyloid or SAA. An acute phase, this is also called as acute phase reactant produced by the liver, which is elevated in especially ongoing chronic inflammation or neoplasia in case of cancer, or in case of chronic inflammations. There is a continuous production of the cytokines that stimulate the liver for the production of such amyloids. The reactive uh, systemic amyloidosis can be seen with a wide variety of chronic diseases, including rheumatoid arthritis, is a chronic inflammation, systemic lupus erythematosus, tuberculosis, also a chronic inflammation, bronchiectasis, osteomyelitis is a disorder of bone, inflammatory bowel disease, and cancer. So all these diseases, they are responsible for deposition of AA in different organs. The next one is the Mediterranean, familial Mediterranean fever has again AA amyloids with a fibrillary proteins composed of the serum amyloid, again SAA. This autosomal recessive disease is characterized by recurrent inflammation, fever, and neutrophil dysfunction. The next one is the hemodialysis associated amyloidosis. When a patient undergoes hemodialysis multiple times, then there is a deposition of protein in those patients as well. And there is the A beta 2 amyloid, A beta 2 M amyloid depositions. So, if a patient is undergoing a process of hemodialysis, then the patient has amyloid depositions. So, it has A beta 2 M type amyloid with a precursor protein A beta 2 microglobulin. This form of amyloidosis may cause carpal tunnel syndrome and joint diseases, because carpal tunnel syndrome, it's a disorder of actually in the carpal tunnel in the wrist joint, and where these amyloid deposits, they start to deposit, and because of deposition of those amyloid protein in a carpal tunnel, in the wrist joint, that cause compression of the median nerve. So a patient can feel numbness in the palm, and numbness in the first, second, third lumbricals. So there will be difficulty in the movements of fingers and sensation of the palm. So because of the compression of median nerve. So carpal tunnel, if you study about the anatomy, you will understand. The next one is senile cerebral amyloidosis seen in Alzheimer's diseases. It has A beta amyloid depositions with the precursor protein of A beta amyloid precursor protein, so beta APP. So the main deposition you just need to remember in Alzheimer's disease is A beta protein, while in case of hemodialysis associated, that is the A beta 2 M amyloid protein. So it is found in Alzheimer plaque and in the cerebral vessels. The gene for the beta amyloid precursor protein is located on chromosome number 21. That is not important for you at this level. You just need to remember that as the protein that is usually deposit in Alzheimer's disease is usually related because of old ages. That's why it's called senile cerebral amyloidosis, and the protein depositions is A beta amyloid. Another protein is TTR, that is transporter of tyrosine and retinol. It's a TTR, and sometimes there will be deposition of TTR as well. So in senile cardiac or systemic amyloidosis, that has a TTR amyloid protein with a fibrillary protein composed of the transthyretin. So there will be transthyretin depositions. This type of amyloidosis is seen in men older than 70 years and may cause heart failure as a result of restrictive or infiltrative cardiomyopathy. So these deposits, they are the fibers they usually deposit in the myocardium. I will show you the image later on, but when there will be deposition of such fibers in the heart, in different layer of the muscles of the heart, then it restrict in the mobility or the elasticity of the cardiomyocytes. So there will be a restrictive cardiomyopathy, and there will be restriction to the dilation of the heart. 4% of African Americans have a transthyretin TTR V1221 mutation, with 1% being homozygous, serving as a risk of cardiac diseases. The last one is the endocrine type amyloidosis. It's associated with the endocrine diseases or endocrine system. Number first is the medullary carcinoma of the thyroid. So when there will be medullary carcinoma, I mean there will be tumor of the medullary cells. Those medullary cells of the thyroid are responsible for the production of the calcitonin or procalcitonin. So excessive production of the procalcitonin causes deposition of procalcitonin in the thyroid gland, that can cause the enlargement of the thyroid gland, procalcitonin. The next one is the adult onset diabetes mellitus. So in that condition, what happened? The insulin is not going into the cell. The cells are resistive to the glucose, or we can say the cell cannot uptake the glucose because they are resistive to the insulin. So once insulin will not act on the cell, there will be no entry of the glucose inside the cell. So the pancreas, they try to make a lot of insulin. Along with insulin, another protein that usually produce, that is called as the amylin. So more insulin, more amylin, both will produce, and this amylin, they start to accumulate into the pancreatic cells in between the cell in the aisles of Langerhans. So then what happened, start to deposit, and gradually this deposition can cause destruction of the pancreatic cells. And pancreatic islet cell tumor can also causes amylin depositions, like especially the tumor of the beta cells. So beta cell tumor causes increased production of insulin as well as the amylin, and this amylin start to accumulate into the pancreas. This is the heart, where we can see there is a deposition of amyloid protein into the inside the heart. The first one is AL amyloid deposition. There is amyloid light chain deposition, which is not clear, but in this image you can find this area where is the deposition of the ATT amyloid proteins. Histologically, if you try to find this image, you can find these are the cardiomyocytes, and inside the cardiomyocytes, these are the normal myocytes, and this is the nucleus, and in between the myocytes, you can find a lot of waxy pinkish substances. So these substances, they are nothing but the amyloid depositions. These are all the amyloid depositions, and these are the cardiomyocytes depositions of amyloid. So this is the amyloidosis of heart, that is the ATTR. The next one is again the same image, but it's a test for you. So here again we can see these are the cardiomyocytes, these are the nuclei, and here is the deposition. So this waxy deposition is nothing but it's a amyloidosis that causes restrictive cardiomyopathy. So what they're saying, it's amyloid accumulation in the myocardium. The staining used is hematoxylin and eosin staining. Protein accumulation, that is the amyloid protein. Call this waxy pink. Organ is the heart because it's a myocyte. Localization of location of the amyloid. This is what the amyloid deposition. Normal cardiomyocyte, these are the normal. Name the amyloid, it's ATT or transthyretin amyloid deposition. The next image is the gross image of the heart. It's again deposition of amyloid in the myocardium. It's a gross image, so no staining. Amyloid protein deposition, a reddish color you can find. Organ is heart. Location of amyloid, this reddish area, these are the myocardium, and deposition of inside myeloid into the myocardium. The myocardium, this one is the myocardium. Chambers, these are the two chambers, left and right ventricle, and valve, this is the valve, mitral valve and tricuspid valve. The next image, go for another one. So this one is the liver histology and gross image. The gross image is showing us the liver. So this is the liver. So these areas, they are slightly yellowish in color or slightly yellowish orange in color. So these are the depositions. Grossly what happened, the size of liver increases and it become hard, and the color will be especially some sort of yellowish color. Okay, so these are the depositions of amyloid in the liver. On histology, you can find such images where they say that these are the amyloidosis of the liver. This low power view of the liver shows sinusoids with that are markedly expanded by a waxy pale eosinophilic acellular material. This material is amyloid and would shows apple bifringes upon polarization after staining with the congruent stain. So this one is not a congruent stain, this is the hematoxylin and eosin staining, where we can find pinkish color. In case of congruent, we find some sort of orange red color. So all these thing we can find here. These are the waxy slightly pale pinkish color. So these are nothing but these are the amyloid depositions in between the sinusoids. So these are the sinusoid cells. So in between the sinusoids, if this one is a sinusoid, this one is a sinusoid, you know, in between the sinusoids, you can find a lot of amyloid deposition that is extracellularly, not inside the cell, and they are acellular, not cellular. Okay, so this is what the amyloidosis on histology of a liver. The next one is the gross image. They are just asking to show something. Okay, so this one is the liver, and it's again the accumulation of amyloid into the liver. Gross image, amyloid protein deposition, color reddish, or we can say a little bit orange in color. Organ is the liver. Location, you know, all these orange or yellowish color things, they are nothing but they are the amyloid depositions. Name the cell of the liver, that is the hepatocytes. So hepatocytes, like a hexagonal cell, you know, somewhat like this. The next one is the deposition of amyloid into the liver, into the kidneys. So how I know that these are the kidneys? So because of the presence of the glomerulus. So this one is the one glomerulus, another glomerulus, and the arterioles, and the tubular network. So these are the tubules. These are all the tubules, and this is the tubular epithelium cell, tubular epithelial cell, and this one is the wall of arteriole, and here we have the podocytes, capillaries, and the basal membrane. So this is the glomerulus, and these are the interstitial or the mesangial cell, or we can say some nuclei of the basal membrane, some nuclei of the endothelial cell, some nuclei of the podocytes as well. And this white area is a Bowman's capsule. So if you try to find deposition, so we can find here is a deposition, and here is the deposition, here is the deposition. So these glomeruli, they're having focal, this one is the focal depositions, and here the diffuse, completely obliterated, you know, completely fibrosed or completely filled with amyloid depositions. So all these, you know, all these things, the acellular material, they are the amyloids, and the amyloid is completely occupying the whole glomerulus. So it's a diffuse accumulation of amyloids. And this one is the arteriole, small, the lumen is there, and this acellular deposition is the amyloid depositions. And these are the interstitial cells. The next image is the gross image of the liver, the kidneys, where they're saying that the kidney size is definitely increased. It's not like the normal one. It's increased too much. The surface become hard, and there will be we can say on cut section we can find some sort of yellowish substance. So these are the amyloid depositions, you know. So this is the amyloid deposition in the kidneys. Gross image, amyloid protein accumulation, reddish, some sort of orange or yellowish color. Organ is a kidney. Location I showed you. Cortex, this part is the cortex. Medulla, just there, just under the cortex. And in the pelvis, this is the renal pelvis. This one is, you know, again the same image of the kidney, but here, you know what, here is a different stain used, that is the Congo red staining. Okay, it's not the HNE staining, it's a Congo red staining. So deposition is again the amyloid deposition in the glomerulus. Type of staining is a Congo red. Protein accumulation color is reddish orange color. Kidneys, the organ is the kidney. Location, you know, all these things or you know what, these are the amyloid depositions. So these are the amyloid depositions, and this is the glomerulus. This is the Bowman's capsule. Inside the glomerulus, there is accumulation of amyloid. Tubular network, you can find these are the tubules. And nuclei, you know, all these are the nuclei. So it's a renal amyloidosis. Next one is a brain in case of Alzheimer's disease, we can find some sort of intracellular as well as the extracellular accumulations. If you talk about the intracellular accumulation of the fibers or the amyloid, so they are called as the neurofibrillary tangles that accumulate inside the neuron and causes destruction of the neuron, especially those neurons which are responsible for the production of acetylcholine. So there will be deficiency, and usually it affects the temporal and the parietal lobe. That's why there will be dementia, agraphia, acalculia. So all these are the manifestations we can find in case of Alzheimer's disease. So there is the neurofibrillary tangles accumulate inside the neuron. So these are the neurons. Here is the normal neuron. Here is the accumulation. As well as some amyloid, some misfolded proteins, some deposition of protein outside the cell as well, in between the neurons. They are called as the amyloid plaque. So amyloid plaque and neurofibrillary tangles, they are associated with the Alzheimer's disease. So what they are saying, a presentation of the basic histology of the Alzheimer's disease consisting of the intracellular neurofibrillary tangles composed of the hyperphosphorylated tau proteins and extracellular accumulation of the misfolded A beta peptide forming the amyloid plaque. So inside it is a tau protein and outside is a beta amyloid depositions. So these two are very, very important. So one more important point about the Alzheimer's disease is the Harano bodies. Harano bodies is also very, very, it's a very, very good and very important. So we can find here, if you're trying to figure out, this is what the neuron, and this is the intracellular deposition. That is the neurofibrillary tangles or the tau proteins. And here is again intracellular. Rather here it's not intracellular, it's extracellular amyloid depositions. It's acellular pinkish waxy deposition. So this is what? This is the A beta amyloid protein. So this is the beta amyloid protein, and this is what we call as Harano bodies. This is called Harano bodies, and it's so shown in Alzheimer's disease. So amyloid plaque accumulation in the brain, H&E staining, amyloid protein pinkish, and the organ is the brain. So this is the Harano bodies. The Harano body is specific for the Alzheimer's disease. Next one, I said that there is something like apple green birefringence. So this one is the apple green birefringence, you can see. So this is again the accumulation of amyloid in the glomerulus. When stained with the conglomerate and observed under polarized light, you can find some apple green birefringence. So I will try to show you. For example, I took, this is the kidney filled with amyloid. I took a sample. This sample I took out specimen. I put a conglomerate staining and I stained it under a polarized light. So and then I can find such image. So this image is what? This is what the glomerulus, and all these apple green color, they are the amyloid depositions. These are the amyloid depositions. So it's specific for the amyloidosis. Accumulation is amyloid protein, color is greenish, and organ is the kidney. This one is again a conglomerate staining. What is this image is showing? This one is, this is again the glomerulus, a tubular network, again the glomerulus. The glomerulus is diffusely occupied or filled with amyloid. Here again we can see a lot of amyloid depositions, but it is not completely red, it is orange reddish in color. So it's a amyloid, it's a conglomerate staining. So amyloid accumulation in the glomerulus, staining is the conglomerate, protein is amyloid deposition, color orange red, organ is the kidney. And the last one is the again the deposition, again the same image, but the staining method is different. So this is what they already shown. These are the amyloid depositions. Amyloid deposition, and amyloid deposition in case of H&E staining, it's pink color, pink waxy pen. So this is the amyloid accumulation in the glomerulus, hematoxylin and eosin staining, protein is amyloid. Pink in color organ is the kidney, because this one is the glomerulus and this is the Bowman's capsule. These are the cells of podocyte or mesenterium or endothelium. So all this and that. So this was something about the amyloid depositions. Thank you.